that you took time in the very beautiful sunny day to come by and listen from some folks regarding the Affordable Health Care Act. And my name is Jo Jacobson. I'm the Washington State Representative for the Alliance for Retired Americans. And we're excited to be over here with you in Spokane. We have some guests that will be speaking to you today about the benefits of the Affordable Health Care Act, because this week is the celebration of the second anniversary. And actually today, throughout the United States, there are activities going on highlighting the benefits for seniors. And so everybody is celebrating the advantages for seniors today at this time across the United States. I know at least within our 30 Alliance for Retired American states. We are fortunate to have with us today one of our national field staff, Dani Pere. She is the Director of Field Mobilization for the National Alliance for Retired Americans. And Dani, would you come forward? She's going to share a bit of a PowerPoint that will get us all kind of on the same page and making sure we understand about the Affordable Health Care Act. Thank you, Dani.
Thank you, Jo. Can everybody hear me okay? Mm-hmm. Okay. Now, if we turn off the light, will anybody fall asleep? Okay, the president of the Washington State Alliance just raised his hand. All right. And can everybody see this okay? Yes. Okay. If at any time you can't hear me, just holler or raise your hand and I will speak up. And let's make sure I can do this okay. So, welcome everybody. Thank you so much to be here. It is such a pleasure to be with you today celebrating the second year anniversary of the Affordable Care Act. And, you know, Jo mentioned that today, March 19th, progressive organizations across the country that work with seniors and retirees and aging organizations are celebrating the second year anniversary. The actual anniversary of the Affordable Care Act is on March 23rd, Friday of this week. And so I wanted to ask you, the anniversary is this week, but does anybody know what's happening next week that's also related to the Affordable Care Act?
All the Supreme Court decisions.
That is correct. What makes the second year anniversary so important, and especially the conversation that we're going to have today about all of the important benefits both for seniors and all of us as Americans, is that next week, starting on Monday and lasting through Wednesday, the Supreme Court is going to host 3 days of oral arguments about the different legal issues that have been raised with the Affordable Care Act. And this is really, really historic. The Supreme Court hasn't had 3 days of oral arguments in about 150 years. And so a lot of time and attention is going to be focused on whether various aspects of this law are legal. And that's important for us today, because if provisions are struck down from the Affordable Care Act, there's a big question if you pull a provision here and a provision there, if the Act in its entirety can withstand those deletions, if you will. So we'll keep that in mind as we go through and explain the Affordable Care Act. Okay, so we know in March 2010, President Obama signed into law the ACA. The health law contains key provisions for improvements for Americans of all ages, from protecting them from the worst insurance company abuses to making health care more affordable and to increasing access to care. But it also strengthens Medicare, and that's what we're going to focus on today. And let me just say that the provisions that I'm going to lay out to you, we believe at the Alliance for Retired Americans, and I want you to tell me during the presentation or after the presentation if you think this is correct, we believe that most seniors and retirees in Washington State and across the country are still not aware of all of the benefits in the Affordable Care Act that are available to them. So after this presentation, I'd really be interested in a poll of all of you saying, hey, Dani, I knew that. I think that's kind of common knowledge, or I had no idea that the Affordable Care Act did that for Medicare. Okay, we know that 50 million seniors and Americans with disability depend on Medicare every day, and the health care law makes Medicare even stronger by making several key improvements. First, it makes many key preventative services available with no copays and no deductibles to help ensure that seniors don't have to skip a potentially life-saving cancer screening because they can't afford it. This is a big, big deal in terms of these no copays and no deductibles. Second, as you may have heard, the law provides relief to people in the Medicare prescription drug coverage gap. So if you fall into the donut hole, as we call it, which is when you're paying prescription drugs between $2,700 and $6,100. Previously, before the ACA, you had to pay all of your prescription drug costs within that donut hole. Thanks to the ACA, now when you fall into that donut hole, you only have to pay a 50% discount on the covered brand name medications. One thing that the ACA does that many seniors and retirees do not know about is that by 2020, it completely covers the coverage gap and eliminates the donut hole within Medicare Part D. So this is a huge victory for us as an advocacy organization. Third, it provides a historic boost to efforts to crack down on Medicare fraud. We've all seen the news stories about hospitals, doctors, different practices, doing fraudulent billing, etc., costing taxpayers millions of dollars. Fourth, this law contains really important tools that will make it easier for doctors to work together and to coordinate your care. And finally, and really importantly, the law does all of this while extending the life of the Medicare Trust Fund. So what this means for seniors is that overall, it strengthens the Medicare program and better meets your needs as a consumer.